Okay, so first I'm going to look at the chart. This is for Elisa Sweet. Her date of birth is 12/06/1979. And I'm going to check for any known allergies. There are no known allergies. And then I'm also going to check and make sure that there is an order to get her central line dressing changed today. Alright, and there is, so we're good to check the chart. I'm going to walk in, I'm going to do hand hygiene, I'm going to provide for privacy. Hi, my name is McKenna. I'm going to be your student nurse today, and I'm going to be dressing, I'm going to be changing your central line dressing. I'm just going to check your wristband real fast. Can you tell me your name? Elisa Sweet. Perfect. Your date of birth, 12/06/1979. Perfect. And then do you have any known allergies? No? Okay. So first I'm going to just lift you up to a comfortable working height. Okay, we're going to get you about waist level.
I know that one's off, and then my face one's a little off.
Put the tissue down. I am going to turn your head to the left, and I'm also going to put the mask on you. And I'm going to put the mask on myself when I get it out of my sterile dressing. Okay. So, first I am going to prime my line. So, I'm going to do that. In an actual clinical setting, this would be in wrapper, but it's not because it's been used a few times. So I'm just going to
It's only because I'm watching it.
pretend
I know
that
I'm
it is.
Okay. And so I don't need that, so I'm gonna lift it down. Okay. So now I am going to
Okay. So we're gonna pretend that this is still in the package and that's sterile.
get this.
Okay.
I would snap this.
And then we're
like
going
lift
to
it
get
up.
half a
So then I'm
milliliter,
gonna actually place it on the side for a little bit. Let it get
half
clean.
an ml of
And then
pepper.
I'm going to go in a circle.
Perfect. So both of these are primed. I'm also going to
Okay.
prime
And
it
then
with
I'm
the
going to
top on too.
I'll
Okay.
put the verbalizer.
Perfect. And then I am going to
I
get
always
my
try to
sterile kit
verbalize
over
everything
here.
you can because
I'm going to open this
like when
away
we're
from
marking
me.
you guys off, we're looking at this a lot of the time.
Okay.
We're not always actually watching you guys.
Away from me.
And then I'm going to
Away from me. Only touching the outer border. And away from me. At this point, I'm going to put on my.
And so then I'm going to
mask.
drop that. Alright. While it's drying,
So I have my
I'm going
mask
to
on.
I got open it
I am
up.
now
I'll
going
use
to
this one.
don
And I'm going
clean
to
gloves.
put some blue Scott.
I would ask my CNA to bring me some clean gloves.
Alright. And now I'm going to.
We could pretend that was in your actual kit too to begin with.
Yeah, I'm sorry.
No, you're fine.
That's, I had said that I didn't say it loud enough. I said I wasn't going to use that one, but I said I was going to use it.
I'll cut it. It's fine.
And this one.
Okay.
Yeah, it's a little
So
Okay,
I'm going to don some clean gloves. Would have done hand hygiene before. And then I am going to not turn my back from my sterile field. Pull this down. And I am going to peel the Texaderm off. And I'm going to make sure that I peel towards the insertion site.
Sorry. This is a little different than this one.
Okay, so we're gonna take this off.
My gloves
In real life, we would throw this away, but I'm gonna never use it for the skill setting. Okay, so I'm gonna take off the bandage and I'm going to put it in here. I'm going to do hand hygiene again.
There we go.
And then I am going to look at the insertion site. I'm going to see if there's any inflammation, infection, loose sutures. I'm gonna check for infiltration. There's no signs of any of that. So
then
you're good. We can chart that later.
I'm not actually going to do it right
And
now.
then I'm going to put on my
right now.
Okay. So I'm going to
sterile
sign
gloves.
my initials, and I'm going to date.
Oh, actually first, sorry, correction. I need to open this up, so I'm gonna open it
And so
away
since
from
I'm
me,
no longer
just 6 inches Trust me, so you need to give me text again.
This piece.
Thank you. So I'm going to, I didn't turn my back to my sterile fields, either of them. Okay. So I'm gonna open it away from me. And then 6 inches above. Perfect. Put that away. Okay, so now that we are all set up, I'm going to open my sterile gloves. I'm going to make sure that I only touch the inside where my hand is going to be going with sterile gloves, so that's good. And then sterile can touch sterile, so I'm going to go underneath the cuff here. Perfect, so I'm now sterile. I'm going to take this, drop it over there. Okay, so now I have my site. I am going to use the chlorhexidine, and I am going to clamp this and push it onto the site. And then after I push it, I'm going to clean in circular motions around the insertion site. And then I'm going to scrub vertically and horizontally around the outside, just to make sure that everything's clean. I'm going to clean the line and where the suture is as well. And then after, I'm gonna throw that away. Okay. And then, now I'm going to use the BioDisc. I'm going to make sure that blue is to the sky. And I'm just gonna put it on just like that. Okay. And now I'm going to put on the dressing. So drop that. And then once the dressing is on, I am no longer sterile. So I'm no longer sterile, so I can touch the patient. So I can take this off. And then I would use my pen. I'm going to initial, date, and time it. So it is 3:10 right now, so 15:10. Okay.
Well, first I'm going to. Okay, how'd you go, Dr.
And then I'm going to put this on the dressing. Throw this away. Now I'm going to take off my sterile gloves. And I'm going to get some clean gloves. Okay. So I'm going to do hand hygiene again. And then I'm going to put on my clean gloves. I am going to make sure that, I'm going to use this one. I'm going to make sure that it is clamped right now, which it is. The line is clamped. And I am going to take off the old one. So we're going to take that off. I would throw it away in normal clinical settings, but for skills we're keeping them. And then I'm going to make sure that I clean the port very well. All surfaces of it. Okay, and that's trash. And then I am going to connect this on here and twist it. Okay, now that it's on here, I'm going to slowly unclamp it, and I'm going to push and pause. Push and pause. Push and pause. And I'm going to keep doing that until everything is gone with the syringe. Okay, and then as I'm about to insert the last bit, I'm going to slide the clamp over. Okay, and then the heck. Why did this come off? So it came off in the wrong place, but no problem. It didn't touch anything. Okay, now it's off at the right place. So now this would have a cap on it, but for skills purposes it doesn't. I'm going to tighten the heparin on. I'm going to unclamp it, push it in, and then clamp it back. Okay. then also, again, in a clinical setting, this would be a brand new one, but I am going to put this on, and I don't have to put any alcohol because it's remained sterile. So now that that's on, I am going to ask the patient how they are doing. I'm going to make sure that they are comfortable and covered up. I'm going to make sure I put the bed back down to the lowest position. And then I'm going to take off my gloves and provide privacy, do hand hygiene, and I'm going to document all my findings on the catheter.